Are you 64, going on 65? Then it's Medicare time. Time for you to look at all of your Medicare options, and you need to do it now. Welcome. My name is Mark Sanis, and I am the owner of Sanis Insurance. We are an independent Medicare agency licensed in Washington and 11 other states as well. We have an office at 100 North Mullen Road, Suite 101 in the Spokane Valley, and you can call us to set up an appointment by Zoom, by phone call, or even come in person. Our phone number is 509-993-9887. Now, why should you choose us to navigate the waters of Medicare insurance for you? Well, first of all, Medicare insurance is very confusing. Our team has over 30 years of experience and customer service in the insurance industry. We are independent agents, meaning that we're not captive to just one carrier, and we are appointed to sell over 45 different Medicare insurance plans. So you can be assured that we'll help you find the best plan that matches your individual needs for health, financial, and lifestyle. We are huge on education and service. So we have put together this little video, and it's kind of a Medicare 101 training. It's about 40 minutes long, so grab yourself a little beverage, a cup of coffee or tea or whatever, and sit down and take notes, and then we can get together and help you out. But it's not as easy as just going to property and casualty, which is an auto and home insurance agent, where you can change your policy the next day. Medicare is a lot different. You need to be a certain age. You need to have a certain residence. You need to have a certain zip code. And time of year is important as well. So there's just a lot of little technical things that we can help you avoid and make sure you get the right policies that are available for you. So let's begin. Medicare the Smart Way. This is just a quick roadmap, 4 easy steps, but there is a lot to it. So once you have finished this course right here, you will be a Medicare expert, and you can also call us at any time. We don't charge anything for our services, and we're here year-round for you. We get compensated by the carrier that you choose, and it doesn't increase the amount you'd have to pay. So why not use a good independent Medicare agent? So here we go. Medicare the Smart Way. So quick overview. It's a roadmap, 4 easy steps. The first one, learn how Medicare works and what it costs. So we're going to talk about original Medicare. We're going to talk about Medicare Advantage plans. We're going to talk about supplements, which are Medigap plans. We're going to talk about prescription drug plans. And then we're going to go to step 2, and we're going to actually compare the Medigap, which are supplements, versus the Medicare Advantage plans. Which one's best to use and for your needs. There's pros and cons about them both for sure. Step 3, we're going to talk about some additional products in the Medicare insurance world that can help fill the gaps. There's dental, vision, hearing, of course. There's also cancer and hospital indemnity type plans that can also help you reduce deductibles, copays, and coinsurance. And then step 4, we're going to talk about the enrollment periods, when and how to sign up. We'll talk a little bit about some Medicare myths at the end, and then we'll go into next steps, what you actually need to do and when you need to do them. So let's begin. Just so you know who we are, I am Mark Sanis, and my wife is Sandy Sanis, and we run and own the Sanis Insurance Agency. We are experienced. We have over 30 years of industry experience. We are licensed independent agents in 12 different states. We are appointed with 30 different carriers and 45 different plans. And as we kind of mentioned before, education and service are what we really push. We want you to be educated so that you're making a good decision. And then we follow up with the service to make sure you've got what you need and answer any questions throughout the year. So we do have annual reviews, and in September we send out emails and let you know that we are available to review your plan, your current plan, against next year's plans. We look at your doctors to see if they're in network or if there's plans that you can get that have a PPO and allow other non-contracted doctors to have coverage. We also look at the prescription plans and analyze them accordingly to every single carrier's formularies out there, and they change all the time, believe it or not. And then we put it all together, and we will help you with the application process and look at benefits as well on each plan and find out which one's best for you. We do have that wide variety of insurance products, year-round service availability. We already mentioned our services are always free all year round, so feel free to give us a call anytime. And it's very easy to schedule appointments with us, from a phone call to a Zoom call to actually coming to the office if you're local. So a lot of experience, and we're here to help you. So let's learn how Medicare works and what it costs. So you'll see there's parts A, B, C, and D here, as well as a supplement. They've never given a supplement a letter. Maybe they should. Part E. There you go. So let's talk about Part A and Part B. This is what we call Original Medicare. When you first sign up for Medicare, you're going to get a red, white, and blue card, and it'll have Part A and Part B on there. Part A is hospital, and Part B is medical. Once you have both of these coverages, then you have the option of choosing Part C, which is our Medicare Advantage plan, very similar to employer plans, or you can choose a supplement with a standalone drug plan. Supplements are medical, and Part D is the prescription standalone plan. Now, Medicare Advantage Part C includes the medical and the drug plan together, so you get the best of both worlds there. So let's go back and find out what is Part A and Part B. What does it cover? So Part A, hospital. Think of it as inpatient coverage. And then think of Part B as outpatient, your doctors, your providers. It also covers durable medical equipment, wheelchairs, oxygen, that type of thing. And Part B covers many preventive things. There's, I think, over 24 preventive items that are all $0 cost for you. Mammograms, flu shots, vaccines, cancer screenings, etc. So on all the plans, they're down to zero on that, but they are covered under Part B. Now, there are charges for these two coverages. So the first one, Part A, if you're just on this coverage, the first time you went into the hospital for something, you would be charged $1,676, and it's per event. And these costs do change every year. They do go up. They never seem to go down. So it'd be $1,676 for every event. You might have a shoulder surgery one part of the year and then a knee surgery the next later in the year, and you would be charged the full amount. Even if you were there just for a day, it's per event. There are co-payments. If you stay past 60 days, so 61 through 90 days, it would be $419 a day on top of the $1,676. And if you were there past 91 days, it would be $838 a day. So while it's coverage, it's very, very expensive. Now, there are premiums to this coverage. However, you might not have to pay them. The average premium for 2025 is $518 a month. If you have worked during your working career and paid taxes for 40 quarters, which is 10 years, then they're going to subsidize that premium down to zero, 100%. So your premium for Part A most likely is zero. Now, Part B is a little different. It has a deductible. It's $257 one-time annual deductible this year, and it also does go up every year a little bit. There is a co-insurance phase as well, and they will pay 80% of these bills. And remember, we're talking doctor bills here mostly. So you have to pay 20%. So think about that. An average, not average, but a surgery nowadays, $100,000 is not out of the world here. And a $100,000 surgery, half of it's doctor bills. That would be $50,000, and you would have to pay 20% under this coverage. That's a $10,000 bill. So that's very, very expensive. Now there is a premium also on Part B, and if you make $106,000 or less, if you're single, then the premium is $185 a month. They are going to subsidize this premium down 75%, and so most people will be paying that $185. Now, if you're joint, I believe it's over $200,000, and I have a table in here that we can take a look at, because they do look at your income, and they adjust it accordingly, this premium. Now, it's called IRMA, so it's the income-related monthly adjustment amount, and they do a 2-year look back at your income. And since they're working with the government and Social Security, they have a list of everything you made for your income taxes all the way back to when you were a child. I looked at mine and I saw I made, I think it was $68 when I was 12 years old, so must have been my paper route or something, but it's kind of fun to look at those. Anyway, they'll do a 2-year look back from now, so if it's 2025, they will look back at your 2023 income, and they'll determine then what your premium will be. Okay. Now again, most people it'll be $185, and this does go up every year a little bit as well. Okay. So next, you go ahead and you sign up for Part A and Part B, and this is the type of card you will get. Your name will be on there. They used to use Social Security numbers for your ID number, but they've changed those now, so that's good. And then you'll have Part A and Part B, what we call effective dates, the very first day that they're effective. And usually, if you're just turning 65, it'll be on your birth month, so it'll be the first of your birth month. If perchance your birthday is on the first of a month, then they actually go back a month earlier. They go earlier a month. So that's when your effective date would be. But you'll get this red, white, and blue card. That's your actual Medicare card, and you have coverage now for A and B. Now, can you defer Part B if you're working with an employer? Yes, you can. And I don't know if you'd want to, because the Medicare Advantage plans actually usually are a little bit better than the employer plans, but we'll get into that in another section here. But you can defer it, and so you could get Part A, and then later on, once you're retired from you're past 65, but you keep working and now you're going to retire, you can then get Part B. And if you worked for a creditable insurance plan with your employer, then you will have no penalties. There are penalties if you didn't have creditable insurance, and they deem credibility by the number of employees on the plan. So if you had 20 or more employees on your plan with your employer, then you have creditable insurance. If you have a plan that doesn't have that 20 number of 20 people, it's a smaller business, then you need to get your Medicare insurance very soon when you turn 65. And we'll talk about that time period too. You have a 7-month actual period to sign up and get your Medicare right around your birth month of 65. Okay? So once you get your card, it'll look like that. And now we have the chance of reviewing the Medicare Advantage plans and or supplement plans. But let's take a look at Medicare Part C, which is Medicare Advantage plans. So these are basic plans. They're offered by private insurance companies. Medicare Advantage coverage must be as good or better than original Medicare coverage, which we just looked at. So it is, because it gives you dental, vision, hearing, gives you a lot of different benefits as well over-the-counter money sometimes for vitamins and that type of thing. Fitness plans are paid for. Sometimes chiropractic, sometimes you get acupuncture. So there are a lot of benefits that are included with the Medicare Advantage plans, and they are perfect for the right person. Medicare itself, the government part, does not endorse or recommend any plan. They just simply approve them to be sold. Most plans will include the medical and the drug plan. They call those MAPDs, Medicare Advantage with Prescription Drug Plan. Now, there are some plans that are just MA, Medicare Advantage only. They don't include the drug plans. Those are perfect for veterans because veterans get most of their meds right out of the base. And so for a nice low cost, they get them and they don't need that coverage. Yet they can still work with their VA plans and their VA doctors and work with a Medicare Advantage plan as well. Since most Medicare Advantage plans are $0 premiums, now they get all of the benefits of the extras. So they get the dental, the vision, the hearing, the over-the-counter, those things that we just mentioned. So it is really advantageous to them to get a Medicare Advantage plan and still work with the VA as well. Now there's some acronyms here. Basically HMOs, PPOs, and Medicare Advantage plans have mostly HMOs. It's a health maintenance organization where that means their doctors are contracted, and you need to go to one of their contracted doctors to get the really good rates. Okay, but they also came out a few years ago with PPO options. That's preferred provider organizations, and the best of both worlds is the HMO/PPO option. And what is that? What it means is the PPO lets you go out of the contracted doctors and see a non-contracted doctor. There's still coverage. Now you'll be paying a little bit more, but it allows you to do that, which is fantastic. And they also have special needs type plans. People that are on Medicaid, making $12,000 a year at most and virtually no assets, they can get on what's called a dual special needs plan, and those are pretty fantastic. There also is chronic pain type of special needs plans with different criteria as well. So if you know of anybody that has those type of issues, we can definitely help in that arena. Okay? Next, to be eligible, you got to reside in the service area. Medicare Advantage plans usually go by the zip code and county of a state, and then the supplements go by the state. So if you think about it that way, then you'll realize, okay, if I move from one county to another, I better check and see if I need to switch my Medicare Advantage plans to one that's in that county. If you move from state to state with a supplement, you can actually keep your supplement because it's good in all the states. So you need to reside in the service area. You do have to be awarded Part A and pay for Part B. So basically you've got to have A and B before you can get a Medicare Advantage plan. A lot of people don't realize this, but once you join a Medicare Advantage plan, the government is going to give approximately $10,000 on your behalf to that carrier, and they do that yearly. They do these wellness checks, which are different than a physical, and it's basically a questionnaire on your health. And they do this for every client in their base that they have, and they might do a wellness questionnaire on you and your good health for your age, and so your Medicare Advantage company will get $10,000 every year. They may do one on me, and maybe I've got all kinds of issues, health issues. So they will go ahead and give $15,000 maybe for me. So that's why they do a questionnaire on every single person every single year that they're insuring. Now with that money, the health insurance company now can lower those premiums, and that's why most of the Medicare Advantage plans are down to $0 premiums and it gives them money to increase the benefits. So the dental, the vision, the hearing, they can offer all of that, which is fantastic. So now you know that the money does come back to you after all these years of working and paying your taxes. Now, if you choose a supplement option, they don't get that benefit coming back from Medicare. So that's why their costs are quite a bit more. But we'll talk about that too and why there's still good options there. Some of the Medicare Advantage plans include low premiums, as we talked about. They're very similar to an employer plan, so they will have deductibles, copays, and coinsurance on the different things you need. There is a maximum out-of-pocket limit on these. Original Medicare and supplements basically don't have a maximum. They can go pretty high. However, on these plans, there is a maximum. In Washington State, a lot of the plans are in the $5,000 to $6,000 a year max. However, 95% of the time, you're not going to hit that because the underlying coverage of inpatient and outpatient coverage limits the amount you would have to pay per day up to usually 4, maybe 5 days, and then it pays 100% of everything. So it really does take care of you that way. Now, if you had something really major, multiple surgeries, maybe you got cancer and had to have a lot of chemo, then maybe you might hit that maximum for that year, and then we'd have to see about next year if you would even get close or not. But those are questions for us to decide and work with you on to make sure we get a right plan for you. So think of these plans very similar to employer plans. It's pay-as-you-use type plans. So in other words, if you go to see a doctor once or twice a year, usually there's no charge for your primary. There's probably a $40, $45 charge for your specialist. And you go and see them just a couple of times a year. Everything's fine. You're healthy. And you don't use the plan. But it's there if you need it. And if you don't use it, you don't incur any of the deductibles, copays, or coinsurance with the different things. So all in all, it's a pretty nice plan. And you get those extra benefits as well. So again, those extra benefits, they're all different on the different plans. There's no standardized choice. Dental, you can get preventive and comprehensive on some plans. You can get routine vision, including the exam and hardware. You get hearing exams and hearing aids, which we all know are very expensive. Fitness programs are generally covered. Over-the-counter benefits, some plans give you a dollar amount to buy those vitamins or braces and that type of thing every 3 months. And then additional benefits. Some plans give you chiropractic, some give you acupuncture. There is one that gives you naturopaths. So it just depends on what your needs are and what plans are available for you. And that's where we come in to help you with all that. All right, so let's get back to the parts. We looked at Medicare Advantage plans as one of the options. Now you might choose a supplement rather than the Part C. So what are supplements and why would you need a standalone drug plan to go with it? Well, supplements are medical coverage. That's what it basically is. And they supplement A and B. Remember those percentages I told you that we had to pay in here and the costs? Well, that's what a supplement does. It covers that. However, supplements are costly by themselves with premiums. And since it's just the medical portion, then you would need a Part D prescription plan to go with it. Okay, so let's talk about supplements. What are they? How can they be helpful for us? And do I need one? So, supplements, which are also called Medigap, they come in letters A through N. Look at all that. Just to confuse us. These are not the parts. These are the plans for supplements. Now, notoriously, the F, the G, and the N are the most popular plans out there. We cannot get the F plan anymore because you had to be 65 years of age by January 1st of 2020. And they came up with a new rule that if you're past that, not 65, you're no longer eligible for the F. Now, there are still people on the F plan. It is still around. However, the pool of those people are diminishing, and so the cost of the F plan is going very high. It approximately in Washington State, which is community rated, is around $350 to $380, depending on the carrier. The G plan, well, let's talk about the F plan. Look at down here. Basically, you can see all of the coverages in F, and it's paying 100% of all of those, which is fantastic. So those, if anything's medically necessary and your doctor approves it, you pretty much have coverage here. It even gives you foreign travel up to $50,000 at 80%, which is great. But if you can't get it because of the age that you are, the G plan is your best option. So look at this. It also is at 100% for just about everything, including foreign travel, except for one area right there, and that is your Part B deductible. So while the G plan costs less, and I'll tell you that in a second, you also have to pay this Part B deductible, which is $257 this year, and it does go up a little bit every year. Now, the F plan I mentioned is $350 to $380 per month per person. The G plan is substantially less. It ranges from $250 to $280, and there are, believe it or not, one or two that are still down in the 220s. So what I mean by that is these plans are what we call standardized. So a G plan is a G plan no matter what carrier you go with. You might go with United Healthcare or Humana or Aetna or any of the others, and it's going to be the same coverage. Now the price might be different because maybe that company wants to add new business, or maybe they've got enough business and they want to slow it down, so they're going to charge more. Maybe they include a gym membership. Some of them do and some of them don't. Those that don't might be a little lower in price because they don't have to incur that. But the G plan is super, super popular because it does cover just about everything except for that Part B. Okay? Now we talked about all Medicare supplements are standardized. There are no networks and no referrals with supplements. Referrals used to be a big thing, but you know what? It's the click of a button and a form now between your primary care doctor and the specialist. And most insurance companies do not require referrals anymore. So if you're on a Medicare Advantage plan, you really don't have to worry about that too much. And I say that because it still might get delayed, but it's probably because they didn't send the referral over electronically, or maybe they got it, the specialist, and they just haven't looked at it yet. Now, specialists do require referrals generally from the primary care, but it's not the insurance company that needs it. They just want to make sure the person coming to them is there for the right reasons. Okay? So with supplements, there are no networks. You can go to pretty much any doctor out there that takes Medicare assignment, and 95% of them do. So it is nice that way. Now with Medicare Advantage plans, you do need to go to their contracted doctors, or if you have a PPO plan, you can actually go to an outside non-contracted doctor, and you will have coverage. You'll pay a little bit more, but you can do it. There are also a couple of companies out there that give you automatic coverage when you're traveling. Actually, most of them do, and it's called emergency and urgent care. Worldwide coverage on that, not just the United States. So that's fantastic as well. All right. Next up, we're going to talk about, let's see here. There we go. Supplemental open enrollment. So I mentioned when you're 65, you can sign up for Medicare, and you can also get your Medicare Advantage plan then. If you want to go for a supplement as opposed to a Medicare Advantage plan, you basically have 6 months past when you sign up for Part B, that effective date. And then there will be no health questions. They won't do any look back on you. If you miss that date, You then will be what we call medically underwritten. And if that's the case, then they will go and ask you 30 health questions, and they're going to ask you, have you had cancer? What drugs are you on? And they'll be able to tell with all these questions if you have a lot of significant health issues. And if you do, they might not accept you, and you'll be denied. So then you'd have to stay on the Medicare Advantage plan, which isn't bad. However, if you want to move to a supplement, generally it's because you've got a big issue, a health issue. And a lot of times on Medicare Advantage plans, if you do get cancer and chemo is involved, chemo is very expensive. Medicare Advantage plans will pay 80% of that bill up to that max, so you are covered that way. However, you're going to be paying 20% up to that max. So it can be a little expensive for you. And on a supplement, it pays 100%. But again, look at how much you're paying for the supplement. You might be paying $250 a month, and you also have to have a prescription drug plan on top of it. So if you combine those two, you're probably looking at $300 a month times 12. That's $3,600 you're putting out for premium just for the coverage, and you haven't used it yet. If you have hit health issues, then yes, you might want to just move to a supplement right away. Most people, if they're healthy, will start out with a Medicare Advantage plan, and eventually, if they can, well, most of them just stay with the Medicare Advantage plan. However, some, there are time limits on things too with supplements. So if you did have, just say, cancer and it got resolved, and a lot of times it can nowadays, then there's a time limit. Did you have cancer within the last 2 years? It would be one of the health questions. And so if you can then answer no to all those questions, you can then be reinstated into a supplement. So there are technicalities around all of that, but most people, when they're on a Medicare Advantage, will probably just stay on it because it pays well and it has good coverages and you get all the benefits. But supplements are great all around as well. All right, so let's move to the next one. Plan G, we talked about you'd have to pay the Part B deductible, but it pays so well on everything else, so it's a great option. There's also what we call Plan N, and this is popular as well. You'll notice in the green box there it does pay 100% for medically necessary Part B items, but there's 3 little dots there, and it means you have to pay $20 for your doctor visits, whether they're primary or specialist, and you'd have to pay $50 for the emergency room, and you have to pay that $257 Part B deductible. The 4th thing that you have to pay for is what we call excess fees, and a lot of people have never heard of these before, but there are 3 entities that can charge up to 15% over and above the bill, and yes, you would have to pay them if you had this coverage, Part N or Plan N. So what are they? One are doctors. They can charge up to 15% more, but I've never seen a doctor do it in the 12 states that I'm involved in. Labs can do it. I have seen a little bit of that where you're charged a little bit more. And the next one is transportation services. So if you think about a life flight, if you had to be flown in to the big city from outside of the city, at least here in Spokane, it's about a $20,000 charge. And if you had a 15% bill on top of that, you're talking some money here. You're talking $3,000. So to avoid that, there's a company called LifeFlight, and you can Google it. They don't have agents per se. So just Google it. It's basically $75 for the entire year, and not just for you, but also a spouse or whoever else you might have on your taxes. So it is fantastic. I do go to a lot of the lakes and outside of Spokane here. We have a lot of them. And I'm always looking around like, where would a helicopter land? Well, I tell you, they do. I have a lot of different instances with clients. I had a couple last fall had a son at WSU in Pullman, and he had to be life flighted to Spokane, and it was over 20 grand. I've had an interesting situation where a customer up in Chewelah was having a lot of seizures, and he told me he had to be life flighted, and they did find a way to get to him, and believe it or not, it was 40,000. A long time ago, I had a couple that had an embolism in the wife's head, and she had to be life flighted immediately to Harborview over in Seattle. And back then, it was 40,000. Now, you could say it's probably a lot more than that. So, to pay $75 for that coverage is fantastic, and it's there for you if you need it. Now, it's probably rare it's going to happen, but you know what? Nice to have. Also, on your Medicare Advantage plans, a lot of the life-type flights, ambulance and life flights, are covered with a small copay, so you don't have to worry about this. And the G and the F also provide coverage for it, so you don't have to worry about that either. So that's N. I do have a lot of people on N. They love that plan, and I just highly suggest getting the life flight so you do have that coverage and won't have that expense if it did happen. Next, Washington State. It's a really good state for supplements. It allows for what we call portability. So back in the 80s, there was an insurance commissioner by the name of Deborah Sen, and she got it approved that if you're on any supplement, you can move to another supplement, guaranteed issue, and monthly. So no look back on any history, and you can move up or down on coverage and get whatever plan you want the very next month. So every March, April, sometimes May, all the carriers raise their rates, and traditionally on supplements they raise them 3 to 5%. In the last few years, I got to tell you, it's been spotty. Some have raised 2 times during the year. Some have raised 15 to 20% during the year, and we're seeing a lot of increases here recently. So what's nice about this rule in Washington State is that if all of a sudden your carrier started charging tremendously a lot more, you can move the very next month, and we can help you do that to a lower rate plan and on the same coverage, G or N or whatever you wish. So that is fantastic that we can do. Now, in certain states, they have what's called the birthday rule. And so in Idaho, Oregon, and California, basically if you're on a supplement, you can't move. You're kind of stuck. And they start the prices when you're 65 at this level, and as you get older, it just gets more and more expensive, and you really can't switch. Well, they made these birthday rules so that around approximately 60 days, right around your birthday, you can move and you'll be guaranteed issue. So it is great for these people to be able to do that, and we've helped a lot of people in these states do that as well. Lower their rates and give them better coverage. All right, so you're an expert on those. Let's go to prescription drug plans. There's been a lot going on with this last year. Prescription drug plans, they're offered by individual insurance companies, Humana, United Healthcare, Mutual of Omaha, WellCare, Aetna. You've probably seen all the ads. They basically have individual standalone drug plans, and they have the same drug plans that work with the Medicare Advantage plans included. So in most cases, when you have a Medicare Advantage only medical plan, you can't add a standalone drug plan, but you can get a Medicare Advantage with a prescription drug plan. So again, a little technicality there, but we can help you avoid any penalties or problems with that. Once you add a plan, it usually cancels the other plan, so you don't want to add a drug plan after you have a medical plan, and then it would drop the medical plan and you're just stuck with a drug plan. But you can get the MAPD that includes both, so we will help you on those situations. And also adding an individual PD plan, oh, I just talked about it, may result in cancellation of the Medicare Advantage plan. So we just want to keep you out of those situations, and that's why it's really good to work with an independent agent. All right, tier levels. Every carrier will look at their list of meds, prescriptions, and they aren't all the same. For every carrier. They're different. Some will pay for this, and some will pay for that, and some won't pay for this. But they tier level them. Tiers 1 and 2 are what we call generics. Those are the drugs that sometimes are zero cost for you or very little, and these are preferred and non-preferred generics. Tiers 3 and 4 are what we call preferred and non-preferred brands. And brands have larger copays, and sometimes upwards of $500 a month, so they can be expensive as well. And then there's your specialty drugs, tier 5, and believe it or not, I've even seen some that are $10,000 copays a month, which is just ridiculous, but it's there. So they'll tier level all of these medications for you, and then every year they change their tiers. So you may have a group of actuaries at one company that say, hey, we're going to take this tier 3 drug and we're going to move it to a tier 2, so it costs you less. Yay. And conversely, they may move one of your tier 2s to a tier 3 next year, and now you have to pay more. So that's where we come in, and that annual checkup for new plans is really going to be good for you. And we do that for no charge. So get with us, and we'll annually look at that for you. All right, so those are the tiers. Just some basic terminology. You all know about quantity limits, most likely. You can only get a certain amount of pills per the plan, per the doctor at times. Step therapy, if you ever hear about that, or you hear that words, it pretty much just means they're going to start you on the lower end generics first, and then wean you up to the more powerful type medications. And you'd have to have what's called prior authorization to do that. Your doctor needs to be approving, and also the plan as well. And then lastly, there's a thing called transition fill. So if you move from one plan to another at the beginning of the year, you have 90 days basically to make sure you get your prescriptions. It's a one-time refill from the prior plan, but it makes sure that you get your meds timely. So that's a good thing. Now, there's a thing called Low Income Subsidy, LIS, or they call it Extra Help. And it basically is just a form that Medicare has. And if you have really low income, less than 20,000, but maybe more than 12, because you'd be on Medicaid if you had only 12,000 coming in a year. But you're somewhere in between the 12 and 20, and you don't really have any assets, then you can apply, fill out the form, and if you get approved, whatever plan you go on, they will reduce your Part B premium, your Part D premium, which is the drugs, and they also can reduce all of your drug costs down. It eliminates what we call the coverage gap or the donut hole, and it really is a good thing. Now, I've always been told there's a pretty good percentage of people that don't even realize this is available for them. So if you do know someone, or you yourself are in this situation, ask, because this really does help save you some money on the medications and the premiums as well. All right, in 2024 and backwards, when I first started 9 years ago on this, there are 4 phases to drug plans, whether it's with the Medicare Advantage plans or if it's a standalone drug plan. 4 phases. There's a deductible phase, there's the initial coverage phase, there's the donut hole or coverage gap phase, and the catastrophe phase. And these phases are throughout the year. So in January, notoriously, people are going in to get their prescriptions on the new plan that they just signed up on, and all of a sudden they're getting this, your $20 medication also has a $590 deductible on it. And so is shocking, and we get the phone calls. Yeah, but we always explain to them that yes, all plans have a deductible. Now, if you're on a tier 3, 4, or 5 medication, you're subject to the deductible. If you're on a tier 1 or 2 generic, you're not subject to the deductible. But notoriously, you might be on 1 tier 3, and yes, now you have to pay that deductible in January. Sometimes they spread it out between January and February, but mostly it'll be that first month or two. All right, once you're past that deductible phase, you go into what's called the initial coverage phase. And now you have to pay 25% of the fake retail that the pharmaceuticals put on your medications. So they may put a large dollar amount on this, and then you have to pay 25% of that as your copay. Once that number adds up to $5,030 during that year, and remember we're looking back in 2024, then you would be moving out of that initial coverage phase and you move into the coverage gap, or what's called the donut hole. And if you know anyone that's been on the donut hole, they can tell you it's very expensive, because now not only are you paying 25% of the brands, tiers 3 and 4, medications, but you're also paying 25% of your generics. So now you have to reach $8,000, which is your true out-of-pocket during the year at some point, to get out of the donut hole and move into the catastrophic coverage phase, which then does reduce your costs of your drugs. And there used to be a co-insurance clause that's disappearing now as well. But those are the 4 phases during the years: the deductible, the initial coverage, the coverage gap, and then the catastrophe coverage. And once you're done with that, guess what? You get to start all over in January and do this all again. So very expensive. There's a lot of money there. $5,000 and $8,000 limits just to move to the different levels is very, very expensive. Now, this is the way it's been done for years. And they just made a change. So back in 2022, a bill got passed, and it became effective in 2023 and beyond. So it was tied in with the Inflation Reduction Act, and there's a part of that act that applies to Part D medical coverages. So in 2023, the vaccine coverage got expanded and the costs were reduced. So, for example, a shingle shot used to cost $200, and you had to have 2 of them. So 2 shingle shots at $200, that's $400, and now they're down to 0. So that's fantastic. Also, insulin. It used to be those costs $500 a month copay for your insulin. They've reduced that down to $35 a month now, which is really helping a lot of people. Now in 2024, they limited eliminated, I should say, the 5% coinsurance phase for that catastrophic coverage. So that did help a little bit. But the big change is this year, and it's 2025. So they reduced those $5,000 and $8,000 limits down to $2,000. So think about that. The most anyone's going to pay for their copays for all their drugs for the entire year is $2,000. That's fantastic, especially for those people that are on some very expensive meds. That just limits it right down. So they got rid of that donut hole, the coverage gap phase, and they added this prescription payment plan. So if you can show your meds will cost over $2,000 for the year, they'll put you on this plan that will actually spread out the costs. So it'll be $167 a month approximately, times 12 is $2,000. So this is fantastic. It really will save and help a lot of people. And then in the following years, 20, 26, 27, 28, 29, Medicare for the very first time gets to negotiate prices with the pharmaceutical companies. Never has that been done before. So they're going to look at 10 to 20 of the high cost prescriptions and negotiate prices in each of those subsequent years. So it's a good start. I will tell you that the pharmaceutical companies most likely are losing money because of this bill, especially the $2,000 limit. But that's why they're raising prices on their medications. And the plans are raising premiums on the plans. There used to be quite a few plans that had $0 prescription plans. Now they're going to be going higher. I saw one go to $35, one go to $40 a month. So prices are going up, and we'll see what's going to happen in the future here. And I surmise more people will hit the $2,000 limit because the pharmaceuticals are trying to make up their money. So that's what's going on with the Inflation Reduction Act and how it's actually reducing your cost and limiting them to $2,000. So now you have a maximum out-of-pocket limit on your medical as well as your drugs. All right, so just a quick general look at 2025 Medicare costs. If you were to get Part A and Part B, and if you had worked 40 quarters and paid your taxes, then you're looking at zero cost for your Part A, no premium. Part B, you'd be paying the $185 per month, and you have to pay that no matter what you do over here and choose any of these additional plans. You always will be paying that $185, or depending on how much money you make in the chart that we will look at, the IRMA, it might be a little more. Part C, if you choose that, then the premium is zero, and you get great medical coverage as well as all those benefits, and you get the drug plan as well, all for $0 premium. So this is great if you're fairly healthy. Most people start out here for sure and stay with it. Or you could go to a supplement if you feel that this is the better need for you and you just want to go and get this. It's priced at $250 to $280 for the G and about $180 for the N for your premium. And the Part D prescriptions, which you would have most likely add to that. There are still one or two at zero, but most of them are going to the $40 to $50 a month amount. So how do you choose? Well, if you take a common G, it's $280. Let's just say $250. You get a good deal. And maybe add $50 for the drug plan. You're looking at $300, right? And as I mentioned before, 300 times 12 is $3,600 in premium just for this coverage. But it's great coverage. Now, a Medicare Advantage plan, you'd be paying zero. And if you really didn't have any issues, you just went and saw the doctor once or twice a year, you're not going to be paying anything. It's going to be zero. You're saving that $3,000 per person a year. And you could save enough in a few years to have the maximum covered here if something happened. So you got to think about that, but think about your situation, your health, your lifestyle, your finances, and just which one works best for you. And we'll help you. Whichever way you want to go, we're there to help you. Let's talk about late enrollment penalties. If perchance you're working past 65 and you do not have creditable insurance, when you come back and sign up for Medicare years down the way, you'll be charged a penalty for both Part B and Part D. Part B is going to be 10% of that every 12-month period that you missed from signing up when you should have. And it's 10% of that premium for Part B, which is currently $185. So for every 12-month amount that you missed, you'll be paying $18 each on top of the regular amount that's coming out. So $18 times, say you missed 3 years, it'd be 3 times 18 plus $185, if that's what the price was at the time. So it could be very expensive, and you have to pay that for the rest of your life. Now Part D, same thing, but it goes by month, and it's 1% of the national base of what the premium is for a prescription drug plan. Currently it's at $32 is the average price, but we all know and just heard it's going to go up tremendously. So, but in any event, it would look at every month that you missed when you should have maybe signed up for Part D, and that'll be 32 cents. Well, believe it or not, it doesn't sound like much, but it adds up. It's 12% a year, and pretty soon it's 2 years, 3 years, and it can really add up. So you got to take a look at these penalties as well, and hopefully you don't want to incur them. All right, so let's compare that Medicare Advantage with a supplement and a PDP plan. All right, we kind of already talked about this, but Medicare Advantage, super low premiums down to zero. They do have copays, coinsurance, and deductibles, but if you don't use it, you don't have to pay it, but it's there if you need it. They do have maximum out-of-pocket limits. That's a good thing. HMO, PPO plans allow you to go out of network and use doctors that aren't contracted. It'll cost you a little more, but you can. You may need referrals for specialists, but most insurance companies don't require it. It's the specialist requiring it from your primary care doctor. Now, these plans do include dental, vision, hearing, fitness, and a lot of extra things. So that's great. On a $0 plan, getting all of that extra, it's fantastic. Now, emergency and urgent care used to be covered just in the United States. It is now covered worldwide on all the plans. You can get a Medicare Advantage plan with the drug plan included, MAPD, or you can just get a Medicare Advantage with just the medical part, which is great for veterans. And I might mention that some of these plans for the veterans give money back to help pay for their Part B. And you can see some of the plans that ranges from $50 to $100 a month back. Supplements, higher premiums, but minimal copays because it's going to pay for everything medically necessary. It covers almost all of the A and B costs, including that 20% and the hospital charge. You have the freedom to choose any doctor you want to go to. And again, 95% of all doctors will take Medicare assignment. No referrals are necessary. Some routine services are not covered. You do not get dental, vision, or hearing. You can get those outside of your supplement. We can help you with Delta Dental or Emeritus or some of the other places get that coverage, but it will be an additional cost. You are covered most everywhere in the United States, and you do need to buy that drug plan separately, so that could be an expense as well. So those are the differences. Again, we're going to look at your health, your finances, your lifestyle, and just help you make a good decision. We aren't going to push you any which way. It just depends on what you want, and we'll definitely help you. And then if you ever need a change, we are here for you. So all changes, come back to us, and we will help you review and get that changed appropriately and with the right time limits. All right, some additional products that you can use to fill in the gaps. If you buy a supplement, yes, we'll help you get dental, vision, and hearing in addition to it. Cancer plans. There are some really great cancer plans out there that you pay a small premium now, and then you can get a huge dollar amount lump sum once it's been determined by a doctor that you did have or do have cancer. So if you can get a $10,000 policy and boom, you're diagnosed with cancer and you just get that lump sum. It is great for people that travel a lot for their cancer needs, seeing doctors across the state or in different states, wigs, of course, and just you wouldn't believe how many other things cost money when this happens, and it would be super nice to have that. Hospital indemnity plans. So these plans cover the deductibles that may be in a Medicare Advantage plan. You've got a deductible for this, coinsurance for that. Hospital indemnity plans will charge you a certain small amount monthly, but it covers all that. And so you can virtually have your policy totally covered and be paying just a small amount. And we are paying a $0 premium on the original plan and then a small dollar for the hospital indemnity. That's the best of both worlds right there. All right, enrollment periods, how to sign up. We have lots of acronyms in the insurance world. IEP, Initial Enrollment Period. So when you're turning 65, that's your initial enrollment period. If you're on disability for 2 years under age 65, you also can get a Medicare card and get a Medicare Advantage plan. That would be your initial enrollment period. So basically, when you turn 65, you'll have 7 months to sign up. 3 months before your birth month, and 3 months after. And we highly suggest that you do it right away. As a matter of fact, you want to get your cards early because there's processing time from original Medicare cards to applications for a Medicare Advantage or a supplement. And we want to make sure you get that before the first of your birth month, which is traditionally your effective date. Now, every year there's also called a period called annual enrollment period. This is in the fall, October 15th through December 7th. You can sign up to change your plan to next year's plans. Now, do you have to do that if you're staying on the same plan? No. But if you're switching carriers or switching plans, then yes, and we can help you do that. And some of these plans in January might be better than the one you have. So that's why in September we'll send you out a letter asking if you want a review. And if you do, we'll take a look at all your current meds, your doctors, everything. We'll do the review, and then we'll get back to you and let you know that, hey, your plan is great, I would stay with it. Or, hey, a couple of your meds got bigger, or your doctor maybe moved, and maybe we should take a look at some options. And then we'll have you come on in and we'll do that. Also through the year, there are special enrollment periods. If you moved, maybe you moved from one city to another, then it's time to take a look at the different plans in that area to make sure we get you moved in timely amounts. You have to be moving and get a new plan within 60 days approximately when you do move. So give us a call right away when you know that's going to happen. And then there's what we call Medicare Advantage Open Enrollment Period, MAOEP. So every January, February, and March, you have a one-time shot. If you're on a Medicare Advantage plan, you have a one-time shot to move and change to another Medicare plan. Or you could actually drop it and then move to a supplement. But this is really nice because in the fall you sign up for a new plan, and then before January hits, you kind of find out, ooh, I'm on a new medication that's better taken care of by another carrier or another plan. Or, oh, my doctor left and I need to move to a different plan that has some coverage for the doctor I want to go to. So whatever the reason is, you have that one time out in January, February, and March to move to another Medicare Advantage plan. And then lastly, if you missed any of the other enrollment periods, we have the general enrollment period. And if that happens, we can help you get signed up as well. And then lastly, the supplement Medigap open enrollment period, as I mentioned, is really 6 months past when you sign up for Part B. However, there is one exception. If you're new to Medicare and you're 65 and signed up then, you get 12 months to change from a Medicare Advantage to go to a supplement. So you have that trial right, as they call it, for actually 12 months. But if you've been, your effective date is say a year past your 65th birthday, you're 66 now, you're past that trial right, and you're past the 6 months of the supplement open enrollment period, so they will underwrite you. And so you need to be very careful, if that's what you wanted, to make sure you're getting the supplement when it's open. And we can help you with that too. All right. Am I eligible to enroll? Yes. So if you're under 65 and on disability for 2 years, they will send you your red, white, and blue card, and you can get a Medicare Advantage plan in this state, in Washington. Other states have different laws, and we can help you with those. But a lot of people don't even realize that. They get their original Medicare card, the red, white, and blue card, and don't realize they can be getting even better benefits with the Medicare Advantage on it. So definitely give us a call. We talked about large employers and small employers. and that's how they determine credibility. If you have COBRA, this is interesting. If you're on COBRA, and a lot of people will do this as they retire, they'll go for a few years on or a few months on COBRA. You pay almost twice as much. It's very expensive. However, it's the same insurance. However, it's not deemed creditable by Medicare. So you got to be careful there because you could be penalized if you're on COBRA and came back to Medicare and didn't sign up when you should have. So again, get with us. A lot of rules, folks. We talked about initial enrollment. So the first 3 months before your birth month, and then the 3 months after, you can sign up. We highly suggest you talk to us even before then. And then 3 months out, we can actually sign you up for Original Medicare. And I'll talk to you about that in just a second. But you want to do it 3 months out because it takes them at least 2 weeks, if not longer, to process your OM Red, White, and Blue card. And once we get that, then we have your ID number and effective dates, and we can then apply for whichever plan you want, whether it be a Medicare Advantage or a supplement. That's going to take some time. In that way, you'll get your cards, and they'll be effective on the first of your birth month. If you delay even a month or two in this whole process, it just delays everything else further back. Can be done, but it's really good to do that in the timing of doing it in that first 3 months right here. Now we can talk to you way back here, and we can do the whole analysis and have it all ready to roll, and then your first month we'll help you get your card from Original Medicare and then sign up. So we're all ready to go. Automatic enrollment. If you are on Social Security and getting payments, you will automatically get your Red, White, and Blue Original Medicare card 3 months before your birth month. They'll automatically send it. If you're not taking payments, you're deferring your Social Security. I did that. Then they'll just send you a bill so that you'll have to pay your A and B premiums. And remember, A is 0, and right now Part B is $185 approximately, depending on your salary. But they'll just send you a bill. Now, a little trick. Sometimes they send the Part B premium bill, and they'll send 3 months at a time bill. And so it's like, oh, that's a lot of money. You can go into your Social Security Administration site, and there is a billing link there when you're in, and you can change your Medicare payments to monthly. I did that, and it made things a little smoother and a little easier for me. If you want to pay the 3 month at a time bill, you can, and if it's affordable and you're okay with it, you can do it that way too. But it was nice paying just the $185 a month going forward for me. Now, if you're not taking Social Security payments, then you need to do this manually, and I'll show you how to do that in just a second. We talked about disability too. So if you're 2 months or 2 years before your birth month and on disability, no matter when it is, they'll send you the card, the Red, White, and Blue card, and then we can get you signed up. So give us a call when you know it's going to be coming. Now, how do you manually sign up for Medicare? There's 3 ways. You can go online to ssa.gov, and in the middle of their toolbar is Medicare. Click on that, and you can actually sign up right there. It's a little tricky. There's an application, and we would be happy to walk you through it. It takes 15 minutes. It's definitely the best way to go. You do have to have your password, though, for the ssa.gov site. It doesn't mean you're taking out any Social Security money yet, but you've just got to log in and a password. And we highly encourage everyone to do that right now. I actually have 2 clients in the Spokane area that were hacked. And so when they waited, they deferred to get their payments until they were 66 and a half, I think. And they contacted the government and said, I'd like to start getting my Social Security payments. And the government said, guess what? We've been paying you since you were 62. And they said, I've not been paid. And so it can happen, and we've had 2 people that happen. And now you have to prove to the government that you're you. That took a few more months for them to get that all straightened out. So if you get on this site and you've got your password, you have a little bit more security there. Definitely do it. Now, the other way to do it is to call them, and there's the phone number. It's 1-800-MEDICARE, but 633-4227. You can call them. Plan on a couple hours of waiting on the phone, so keep it charged. But once you get through, usually you get a really nice person, and they will help you for sure. The other way is you can go in person to your local Social Security office. Here in Spokane, it's down on Trent by Gonzaga. And basically you go down there. I would not go on Mondays and Fridays, and I might go a little, not early morning, maybe mid-morning. You will get in. It will take a while. Plan on a couple hours, but you will get to some really good and nice people there, and they'll help you. So the quickest way, of course, is online, and we can actually walk you right through that, and it'll take about 15 minutes. So we highly suggest you do that. Buying a policy when you're first eligible. We talked about supplements, and 6 months past when you get your Part B effective date, you have instant coverage, guaranteed issue, and they won't do any lookbacks. But if you're past that, they're going to do what's called underwriting. And there's no guarantee that they'll accept you if you answer some of their questions yes, like I had cancer, or I do have cancer, or here's the pills I'm taking that might indicate I have an issue. So it can get interesting. That's why a lot of people join Medicare Advantage and just stay on it. All right. So why should you choose us? Well, you just became an expert at Medicare. You're going to forget a lot of the things I mentioned, but that's why we're here. And we are your resource year-round. There's never a charge. We've been doing this for 9 years. We'll be going on 10 here very shortly. Check out our 5-star reviews on Google. You'll see that we have a lot of customers that really like us. And we are really driven to educate them and provide great service. We are building a team here at Sanus Insurance, and we've hired a couple of new agents, and I am personally training them, so they will be giving you super service, because that's what we're all about, and education as well. So check us out. You can call us 509-993-9887, and we can get you scheduled for a conference. There's no obligation. We can do this by Zoom, by phone, and office visits as well. Do go to our website, sanusinsurance.com. We have a wealth of information there, including this video, so that you can really learn about Medicare before you come on in and talk to us. So we highly suggest that as well. So if you have any other questions, give us a call too. We're more than happy just to help people on anything, whether they get a plan through us or not. We just want to make sure you get the right answers and get the right coverage that you need. So we appreciate your time. Really looking forward to meeting you and growing a good I can't even talk anymore. I've been talking so much. Really good to meet you, and I'm going to cut this off before the end of it. So thank you very much. You guys take care, and hopefully we'll see you very soon. All right. Bye-bye.